cleansing process, and that thing keeps coming back and forth. And my mom will always say there are byproducts that goes to affect your vital organs,
Right.
your liver, your kidney. And so why not take, like Dr. Nora said, you are what you eat. Why not take what you're made from? Mama Risa rather has these native spices. This is pepper. Atagbigbe. It's from the other parts of West Africa, and we have the Cameroonians growing this and sending it to Nigeria. We have bitter leaf. Some people call it uziza or utazi, and we use this for cleansing and all of that. Dr. Nora will use this in her blog. I saw a picture once.
And this is a picture showing most of the herbs that we use in healing.
Now, pharmaceutical companies are beginning to use this to make a drug that helps with migraines, acute migraines, and it's called Agbali. So Agbali is used for migraines. So the native people will just boil this in hot water, force you to drink it, obviously, because the smell is not so good. We're going to focus on native medicine in Nigeria today in our discussion. I was talking mostly about how traditional medicine, modern medicine, and spiritual healing processes affect people living in West Africa. From your profession as a midwife, like all these years training as a midwife, what has helped you? What does it mean to you?
For me, and when I'm dealing with my people, health is when you are fine, you do your day-to-day activities, nothing they pay you for body, nothing, you're fine, everything is okay. So health is not really something of a big deal, because I actually specialize more on like the pregnant women, people who want to bring pikin to life. So I don't really disturb myself around it. They are fine, they eat good food, they exercise well, yes, and they're eating vegetables and all the herbs I'm prescribing to them, then everybody's fine. Pregnant women used to see the symptoms in their body already. So that time I used to prescribe like different drugs. I have to go inside the bush, look for the different herbs that will fit them, and then we'll grind it, and then we'll tell them to take it every day and every night. So it depends on the nature of the people, of the customer.
Wow. Oh, that's very interesting. So these midwives are very experienced, and one good thing about it is that if you look into medical humanities, we want the patients to be comfortable with their healthcare provider, and they're very comfortable with the midwives. Thank you very much for being here. So going to move to our gynecologist. What helps to you? What's healing to you? Like, how do you take care of the females that come to you, especially the teenage women?
As a gynecologist, we normally have like different patients coming to use our facilities. So we, based on their conditions, most of the times we have like some coming in with some complications, some coming in with different kind of problems and issues, right? So I know I'll just give a case study of how much herbal African medicine is really beneficial for even in our modern times. Then in some cases we normally have issues with placenta retention. So like every placenta has a name, so it just calls out the name of the placenta, and then it comes out easily compared to us having to struggle to bring out the placenta from.
So those are not scientific ways of doing things. That's more cultural, traditional way of doing things.
Yes, exactly.
Wow.
And this is we normally recommend this to our patients sometimes if it's really hard to get the placenta out.
Yeah.
Pepper soup is very beneficial. It has some health benefits.
Okay.
So now, like, it helps with energy, providing energy to the body. It has fats, proteins, and carbohydrates. It's also rich in vitamin A, vitamin C, vitamin E. It has a lot of nutrients inside it, and they're all strictly herbal, right? And it also helps with the respiratory system, increasing appetite as well, and also controls blood pressure. So these are just some of the benefits of some of the traditional food we eat.
Wow, thank you so much for being here. Thank you for all that elaborate explanation of how you take care of the women in West African region. You maintain the health of people in West African region just before they fall sick and they have to go to meet Dr. Chuku here. So what do you advise men, women, boys, girls when they come to you? What's your advice to them?
Okay. As we all know, they say we are what we eat, right?
Yeah.
So as a nutritionalist, I know that the health of a community is dependent on the nutrition.
Okay.
So we actually advise the community to have a balanced diet. I know the health of the community depends on the nutrition, so we advise the community to have a balanced diet. We advise the community to eat more of fruits and vegetables and less meat and fatty foods. Yeah, so they can usually go the traditional way. They could, in the backyard, they could plant kale, they can plant spinach, they can plant pumpkin, and also fruits and nuts if they can. But they can also go the modern way and just go to the shop and buy the vegetables and fruits.
So you guys kind of integrate modern medicine, or native nutrition and diet to just advise patients.
Yeah.
Okay.
But usually we advise them to go the traditional way to avoid genetically modified foods, which are actually not that advisable.
For your community.
Yeah, true.
So you always advising them to go back to basics, go back to their roots, go back to the ways of doing things before. That is absolutely beautiful. And even if you look into our Western nations today, Western communities, we're advised to go back to the roots, go back to organic foods, eat more organic foods. Pharmaceutical companies, they're going back to using leaves to make drugs and all of that. So native medicine is definitely relevant in our contemporary society. We have a dietitian. She's trained as a dietitian, and she tell us what helps you, what's healing to you, how do you maintain the health of the West African community?
Well, to me, health is being complete. It's more physically, mentally, emotionally, and spiritually as well.
Okay.
So as long as these 4 dimensions are, aligned and all good, then that is what I classify as healthy. So in my practice, just because, I'm from the south of Nigeria and people are getting more Western, they're catching up with times and science. So now we're seeing increase in things like fruit shakes and fruit cleanses and more Western ideologies. So we have, for example, a typical drink that people who are trying to detox will drink is made from udara. Another fruit called ikpakpa. And then, ikpakpa. And then we use orange just to, make it a little bit tasty. And it's very good in helping people, feel full, provides lots of nutrients. As my colleague has said, we're eating more whole, natural grains and fruits and vegetables. The majority of the Nigerian diets are vegetable based, so we have things like egusi.
This is what we call egusi, made of melon seeds.
Which you put in ugu or pumpkin, spinach.
And that's what you have there, right?
Exactly. So that's egusi. So people will grind it, make it into a soup, and lots of vegetables, tomatoes, peppers. It all goes in there. Some oil. So it's really healthy. They would eat it with a root, cassava, which is another whole food.
Native medicine is so relevant in this contemporary society. I'm so surprised that people still run back to native medicine even with all the modern developments and medical technologies. So, we know that their native medicine is very wonderful. However, there are disadvantages and there are bad sides to it. So, Mama Risa, tell us what the downside to native medicine would be from your experience.
I'll say hygiene. Sometimes you see the children falling sick, having diarrhea because of the hygiene. The hygiene standard is not up to what it's supposed to be.
Oh, okay. So, like when you're preparing your native medicines, the use of instruments, how much is that inspected? Because this native medicine is locally practiced, you can just domestically administer them. So are they relegations? Are they officers that come to check your facilities and how you make this medicine?
Oh no office. There's nothing. What are they looking for?
So people don't really inspect these things.
Oh no, it is what I know and what's in my head and my God. Yes. So that's why. And then about the instruments, it's not as much as this because people that call me, they're my people. So they don't really pay me on time. So which money do I have to go and be buying lots of issues? So sometimes I have to repeat the same instrument. I'll boil it inside hot water, clean it with some spirits, and then I'll use it again.
Oh, so funding is not much as
Yes,
well.
yes, funding is not much as well. Yes, you can say that.
Yeah, so native medicine in West Africa, it's very good. However, there are downsides to it, like hygiene, funding, and inspection. No regulations of these things. People just give them to the masses and they don't even check it. So that's one bad side we find out native medicine. Dr. Ara, tell us, what's one downside of native medicine you've discovered with your experience so far?
Okay, yeah. So one issue that we're having right now is the fact that we are limited in the knowledge on how much we can use some of these herbal products, right? So now, as years come by, right, you have the rate of diseases increasing, and I believe that for each of these herbal products we have, right, there's always some other benefits that we are not aware of, and there's need for us to research exactly, do some more research about some of these traditional herbal
spices
yes,
wow.
Exactly.
So we need more research.
We need more
African
research
region.
Yeah, exactly.
Okay, so we need to develop native medicine more, and we hope that people will be able to accept it even more. So Dr. Nora, tell us, what's one downside you discovered with native medicine?
Okay, as you know, like people always say, too much of something is actually bad for you. So what we've discovered is that on native medicine, we don't actually have a standard measurement. So a traditional doctor would actually give a patient like, okay, drink a cup of this and do this and that, but it actually hasn't been tested as to see if that's actually the amount they need or if it's gonna
overdose,
cause side effects.
Yeah.
It actually hasn't been scientifically proven, so maybe that's the downside of it.
So we need more scientific knowledge about these things.
Correct.
People should go research them. And wow. Okay. So we see there are lapses to fill. There are lacunas, empty spaces that we have to fill in the field of native medicine. So Dr. Rubin, tell us, what's one downside you discovered?
I think a downside is documentation. There's not a lot of documentations on all these recipes, so it just dies with the baba or the midwife that knows these recipes. So we need to find a way to begin to document these things, standardize the processes as we've talked about, and just so we can pass it on to the next generation and we can be able to keep it for people to come, because it's very beneficial as we've discussed about.
Okay. Wow. Beautiful. So Dr. Chukwu, tell us one downside to native medicine.
Okay. So in addition to what Dr. Missy said about lack of basic infrastructures and funding, I think the local traditional healthcare givers are uneducated and they're able to keep up, and they're unable to keep up with the other generations of
our contemporary
Yes.
Western nation right now. Oh, okay.
yeah.
So we need more schooling. We need to put
What?
education
for the young kids watching their parents giving healthy and traditional forms of.
So say Mama Risa's daughter is interested in midwifery.
Yeah.
We need more education,
her,
professional education for her, not just learning it from mom, but she
Yes.
needs to go to school, something like that.
And documentation is going to help with that as well.
Oh,
Right.
so they all just play together.
Yeah.
So if we fill up these lapses, we'll see that native medicine is absolutely awesome, and we must integrate it into modern orthodox medicine. Use it for our bodies. They're very good. Like Dr. Nora said again, we are what we eat. We are made of earth, and the best way to treat our bodies will be with what comes from earth: fish, leaves, juices, and even more. So Once again, let's put our hands together for